Good afternoon, everyone. Welcome. On behalf of the Institute on Immigrant Integration Research and Policy at the Rockefeller Institute of Government, we'd like to welcome you all to our webinar, Beyond Inclusion, Expanding the Opportunity Structure for Foreign-Born Americans with Disabilities. In this webinar, we seek to not only analyze the challenges that foreign-born Americans with disabilities face, but provide actionable tools, actionable solutions at the policy and practice levels that can help us dismantle some of these barriers and improve the lives of foreign-born Americans. So this webinar is the first of a series of webinars this year that will look at intersectionality of minoritized social identities and how these intersections shape the lives of people. Intersectionality theory helped us deepen our understanding of the lived experience of people who have different social identities that are minoritized. It helps us understand that forms of inequality and discrimination do not act independently of one another, but instead they intersect, they overlap, they intertwine, and they combine to create really unique experiences, different experiences and instead really of being the same experience as minoritized social identities. These experiences are unique and really experiences whether of advantages or disadvantages. So in many spaces, we still tend to treat these identities separately in isolation of each other. And when we do that, when we treat immigrant categories or immigrant populations separately from a person with disabilities, we tend to fail to create systems that are truly responsive to the needs of these individuals. Each of the categories of identities shape outcomes, as we said, in very unique ways that are not similar to the experience of other people whose identities do not intersect in the same way. So the combination of harm that is created by the collision of minoritized social identities must be unpacked, must be studied rigorously if we are to create systems that work. So today we invited experts in the field to help us make sense of how to create systems that are truly responsive to individuals who have multiple, intertwined, and overlapping social identities of nativity, status, and ability. And the point we emphasize today is that disability looks very different when experienced by an immigrant, and a one-size-fits-all approach to services and support structures can fail miserably if they do not truly understand these different experiences. So today we are incredibly fortunate to have the Honorable Assemblywoman Gabriela Romero, New York State Assembly District 109, who will deliver some special welcoming remarks to all of you. Assemblywoman Romero, the floor is all yours.
Thank you, and good afternoon, everyone. I'm Assemblymember Romero. The 109th Assembly District is my representing district. I represent Albany, Guildland, and New Scotland. Very honored to join you all today. Thank you to everyone in New York State and beyond that are joining us here, and I want to extend a really warm welcome to the more than many hundreds of attendees that have made time to join us for this conversation. I also want to thank the Rockefeller Institute of Government, the Institute on Immigration Integration Research and Policy for convening this important and timely forum and for the leadership that you all continue to provide. I'll begin by highlighting the central theme of today's conference, which is Beyond Inclusion. Beyond Inclusion reminds us that the goal is not simply to welcome people into systems as they are, but to improve those systems so that opportunity is truly accessible, so that dignity and belonging are not conditional. New York State is home to people from around the world, and many foreign-born New Yorkers live with disabilities, visible and invisible, while also navigating language barriers, complex systems, and now more than ever, fear or uncertainty about how seeking help might affect their lives. In too many settings, disability needs can be underreported or unmet due to stigma, communication barriers, and confusing, exclusionary, outdated rules and regulations that keep people from getting the support that they deserve. So when we talk about disability and immigrant integration, we're really talking about how we build a state where all people can be healthy, secure, and fully included in community life, at school, at work, in housing, and in healthcare. And it means looking honestly at where barriers have been set up and then choosing to remove them through design, better information, better coordination, better accountability, and increasing our advocacy. And as a former public defender myself, I've seen how quickly life can become unstable when a person can't access the support that they need. When a challenge becomes a crisis because the system is confusing and fragmented or just like literally inaccessible. And as an assembly member, now in this new role for me as a leader, I see this as an issue of like actual social justice and urgency. We cannot go on shutting people out of their own community. And that's why the work of researchers and practitioners and policymakers in this space is so important, and why I'm really grateful to be with the Institute on Immigration, Integration, Research, and Policy today, and hopefully in the future, to really continue this work and work into New York State. The Institute plays a really vital role by identifying knowledge gaps, supporting applied research, maintaining tools like a data portal, and strengthening the pipeline of future leaders through fellowships and learning opportunities. And the Institute turns evidence into like actual action by providing tools to people like me and local governments and service providers and state leaders and other people to make informed decisions. So I'm really excited for this future partnership. The current climate that we're in, I think we all understand, demands that we ask ourselves if our policies match our values. And there's all these questions, that we're asking ourselves right now. Do people know what help exists? Can they access it without unnecessary hurdles? Are services culturally and linguistically appropriate? Are we building trust, right? So that people feel safe when they actually need support? Are we addressing barriers before people get to the emergency? Are we listening to people actually that have lived experience? And I'm sure that like all these questions are going to be asked today, and we're going to have a very robust discussion. And that's really beautiful because that's kind of the point of making policy. And I hope that those questions get asked. You see it a lot as a legislator that they don't get asked before policy gets made. So it's great that this is happening. To the panelists and organizers, I just want to say thank you for sharing your time and your knowledge. And to everyone attending, thanks for showing up with your curiosity, compassion, and commitment, because this is something that I said before is both timely and really, really exciting to be a part of. And I hope that everyone stays engaged and asks questions and carries today's discussion back with you to your agencies and organizations and campuses and communities and kind of wherever you're in the abyss on this Zoom, because I can't necessarily see. But I think it's not lost on me again that we're in this moment of I don't know if I can say like fascism and chaos. I hope I'm in a community agrees. But when we expand opportunity for foreign-born New Yorkers with disabilities, we strengthen our workforce, our neighborhoods, and our civic life. And ultimately building on systems that work for people facing the greatest barriers make life better for everyone. And I hope we can all agree. So I really thank everyone for being here. I'm really excited to hear what comes out of this discussion and hopefully take it back to my colleagues to make actionable change for New York. So appreciate you having me set the tone for the discussion and hope to hear back from you. Honored to be here. Thanks.
Thank you so much, Assemblywoman Romero. The honor is all ours. We really appreciate having leaders who are committed to inclusion, equity, and to diversity. And really thank you for highlighting the urgency that we have right now at this moment, where we cannot go back to a uniform brush to services and really must look thoughtfully at approaches that ensure that everybody is living a healthy, integrated, and full lives in New York State. Thank you so much for your leadership. And so we'll turn it now to Mia Ives Rubli who is the Senior Director of the Disability Justice Initiative at the Center for American Progress, who is going to share some remarks with us on the work that she does at the Center for American Progress and what you learned from your work about serving immigrants with disabilities. Mia.
Hi, thank you so much. Again, my name is Mia Ives Rubley. I'm the Senior Director for the Disability Justice Initiative. I was also a commissioner for the President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders. My tenure ended beginning of last year. And you know, this subject matter is so close to my heart as a Korean immigrant, as someone who is disabled. You know, I have spent years working in both disability organizing and immigrant organizing. And I always felt like it made me feel like I had to have two different identities when I did my work. And, you know, feeling like I was split into two parts. Part of that was because a lot of the two groups didn't really work together. There was a lot of siloing. You know, when I talk about disability, oftentimes people in immigrant rights communities would often look at me strangely and be like, how does this have anything to do with the work that we're doing? And so that was really, really frustrating to me as I was trying to figure out how to do the work that I wanted to do. However, you know, I think the continued push towards intersectionality and disability justice provided more opportunity for folks like me to work in the in-between and help bring these two communities together to represent people like myself. I think that, you know, it's been my intention to be able to utilize all of my experiences in the work that I do. And I think particularly now, it has become more and more important for me to be able to do that. Immigrants, especially those who are undocumented, have always been a punching bag ever since the establishment of the colonies. No matter the political ideology, immigrants are often blamed for all of society's ills, and this has influenced many of the immigration laws we have had in the past and that we have today. However, right now seems like a especially dangerous time. And people of color, naturalized citizens, and undocumented immigrants are all at risk of being kidnapped by secret police who do not abide by even the most foundational constitutional rights and civil rights laws. This has resulted in an increase in mental health and chronic illness conditions. Those who have been caught up in raids and sent to concentration camps are dying from those conditions because ICE refuses to provide even the most basic medical treatment. A majority of the people who are dying in these detainment centers are people with disabilities. Meanwhile, the federal government is intentionally signing executive orders and pushing to finalize rules that bar immigrants from some of the most basic services, even though they are still forced to pay our federal taxes. President Trump signed an executive order proclaiming English as an official language and is pushing for federal agencies not to translate materials. All of this goes against the Equal Protections Clause in the U.S. Constitution and Title VI of the Civil Rights Act. All of this is intended to create an unfriendly environment that makes it difficult for immigrants, particularly disabled immigrants, to get the services and support they need. It's been interesting in the work that I have done studying how immigrants with disabilities are interacting, particularly refugees are interacting with some of the federal agencies, and seeing how unprepared many of them were and under-resourced that many of them were as they were helping to try and integrate many of these folks into communities. A lot of this had to do with a lack of understanding of what disability was and what services were available for people. Some of this was also an issue of language access. And so we've written some papers around the issues that disabled refugees, disabled immigrants have faced in being able to get the services and supports that they need so that they can become independent in their communities and be able to contribute to their communities as well. That is why this panel is absolutely essential, because we must find ways to protect immigrants, including disabled immigrants. And this can be done through research, state policy advocacy, mutual aid, and community organizing. I really hope everyone enjoys this panel, and I'm excited to hear from others on the panel.
Thank you so much, Mia Ives Rubley. And I'd like to now open up the panel as we discuss and delve deeper into these issues. I'd like to welcome our speaker, Lourdes Aguas. Lourdes is an immigrant program evaluation specialist at New York State Office of New Americans at the Department of State, and Wilma Alvarado Little from the Office of Health Equity and Human Rights Executive Team at New York State Department of Health, and Mustafa Rifat, who is a PhD candidate in social work at Washington University in St. Louis. So I'd have each of the panelists, and we welcome also Mia Ives Rubley to the panel as well. I'll have each of the panelists, starting with Lourdes, provide kickoff remarks, opening remarks, and then we'll delve into the discussion right after. If you are participating as an attendee, please feel free to send us your questions or comments or feedback as we have the discussion. We'll try to address as many of your questions, your inquiries at the end of our conversation, our roundtable. And so I'll turn it over to our first speaker, Lourdes Aguas. Lourdes, the floor is yours.
Thank you so much. And can you see the PowerPoint
Yes, you
slides?
can.
Excellent. So, yeah, good afternoon, everyone. I'm happy to be here. I want to talk to you today about what the Office for New Americans does, and also about its bilingual coordinator program. So to begin, the New York State Office for New Americans, or ONA, was created in 2012, and it is the first statutorily created immigrant service office in the U.S. ONA provides a variety of free services to all immigrants, regardless of immigration status, and it operates through a statewide network of community-based organizations. It offers services such as English language learning, immigration legal services, mental health services, and support for immigrants with developmental disabilities. And in 2019, the Ramirez June Initiative was created, and like ONA, it is also the first of its kind in the nation. It was originally launched as a 5-year grant from the New York State Council on Developmental Disabilities, and the initiative increases access to disability services for immigrants through partnership with other New York State agencies. We also host in-person and virtual workshops about disability services and resources, and we provide technical assistance and trainings for providers assisting new Americans with disabilities who are facing challenges accessing services or benefits. So through the Ona Ramirez June initiative, we saw that more support was needed at the local level to decrease barriers for new American communities to access disability services. So in 2023, ONA launched the Bilingual Coordinator Program, originally as an 18-month grant from the New York State Council on Developmental Disabilities. And so we know that immigrants face really complicated challenges accessing services. And we've had, and especially disability services, we've had cases of that have taken years for new Americans to access the services they need that they would otherwise be eligible for. Some of the barriers that immigrants with disabilities face in accessing these services include language and cultural barriers, the stigma around disabilities, and fears around requesting services. So the Bilingual Coordinator Program was created to provide linguistically and culturally responsive case management support for immigrants with disabilities and their families. And the program serves as a connection to help immigrants navigate and access disability services with a focus on accessing services through the New York State Office for People with Developmental Disabilities, OPWDD. In addition to case management services, the Bilingual Coordinator Program also hosts workshops and makes referrals to other disability services. And to end this short presentation, I'd like to share with you that during the fall of 2025, the ONA team conducted interviews to staff from the Chinese American Planning Council, which is the community-based organization that has been implementing the Bilingual Coordinator Program since 2023. We also interviewed OPWDD staff and ONA staff overseeing the program to gain insights into their perspectives of the outcomes of the program. And what we did is we conducted thematic analysis of the interview material, and we identified patterns and trends across the interviews. I'm sorry, but the sun is moving. Okay. And when we asked these different stakeholders what success looks like for the Bilingual Coordinator Program, they highlighted systemic change. When asked about the ultimate goals of the program, they saw the Bilingual Coordinator Program as providing important services to immigrants with disabilities and their families to quote unquote, level the playing field and remove barriers so that immigrants can thrive in New York State. Similarly, interviewees highlighted that the Bilingual Coordinator Program informs systemic change by elevating the barriers that new Americans face to disability organizations and service providers. Another theme that we found was empowerment. The quote on the bottom left says, having somebody give you a sense of, I can do this, we can do this, is probably one of the most valuable things for immigrant families. And finally, our interviewees described the success of the Bilingual Coordinator Program as an organization that immigrant communities trust. They described the program as a safe and judgment-free environment and emphasized how much community members trust their caseworkers. So I'll end the presentation there, and I look forward to our discussion. Thank you.
Thank you, Lourdes. Now we turn it over to Wilma Alvarado, Department of Health.
Great, thank you so much. All right, thank you, everyone. And thank you very much for the invitation to participate. And Lourdes, thank you so much for your thoughts. I was thinking about some of the experiences that may be supporting each other's work. And so what I'd like to start off with is to talk about the work of the Office of Minority Health and the Office of Health Equity and Human Rights executive team, and the Office of Health Equity and Human Rights, and the department's vision and mission statement. This is something that was created for the New York State Department of Health And this is part of the department's health equity plan. And it's through these principles that the department aims to address the racial inequities and address the disparities experienced by our communities. And so when we talk about health equity, that means for the department that everyone has a fair and just opportunity to be healthy, where no one is limited in achieving optimal health because of who they are or where they live, and regardless of immigration status. That means that to work towards health equity, everyone must be able to access and experience the conditions in life that contribute to optimal health. Safe and secure housing, steady and livable income, quality education, social supports, nutritious food, and safe transportation. And also freedom from discrimination based on race, gender, sexual orientation, disability status, or any other part of one's identity. So in a world where health equity is the norm, everyone has a fair and just access to these conditions and therefore has a fair and just opportunity to achieve optimal health. And so health equity is a foundation to everything we do to help all people in New York achieve optimal physical, mental, and social health and well-being. For healthcare and public health work, applying this health equity foundation involves assessing who may be facing barriers to access services, programs, or opportunities, and taking steps to reduce or eliminate those barriers that exist. So when we're achieving optimal health, that means a complete state of physical, social, and mental well-being. So it is through these principles that the department works towards establishing a department-wide culture where all employees share this common understanding of health equity as a core value in theory and practice, and where all departments are informed of health equity principles. These principles and their impact have an impact also on the opportunity structure that involve and are related to whether you call them social determinants of health, health-related social needs, and the key roles that they play. Difficulty accessing any of these areas often makes it difficult to access others. So without steady employment and livable wages, it's difficult to have enough resources to pay for nutritious food or to pay for safe and secure housing. And then without access to reliable transportation options, especially for individuals with physical or hidden disabilities, ability to access healthcare services, employment opportunities, or nutritious food may also be limited. Because as we're very aware, what is available is not always accessible. So some of the challenges that our communities may face are access to healthcare providers. So for example, if someone is thinking that everyone has a pediatrician, and I speak from the lens of having been a healthcare interpreter for a pediatric subspecialty hospital, not everyone has that pediatrician, and especially when you have specific needs, it's extremely important to have a healthcare provider to be able to address and actually see you so that you are visible and they understand what you're saying. Access to healthcare providers who speak their language, as we're aware, there is a shortage of providers who might look like me or who dominate the preferred language of the individual seeking care to a degree that they actually need, right? The other healthcare related service needs also. Sometimes the language spoken is a proxy indicator for immigrant status. So there's assumption that is made that because somebody's preferred, not primary, but somebody's preferred language is one, then the implicit and or unconscious bias towards the individual or caretaker is connected to an immigration status. They are more likely to be uninsured for the reasons that some of us are aware, whether they do not qualify for certain services or with these very changing and frustrating times are not being provided information that is necessary. they may be more likely to have a lower education and socioeconomic status than English proficient adults, which then circles back to trying to access care, trying to get that time off to take their family member who needs assistance to healthcare services, and also having to balance taking time away from work with a decrease in pay for the time of their absence. And then many have low health literacy, resulting in receiving suboptimal care, quality of care. So one of the things that our office is working on is leading initiatives regarding health literacy and supporting New York State language access law. And I want to take the opportunity to thank the Office of General Services, Office of Language Access for all the support they have provided, and also for our leadership for New York State language access law and the legislation involved to support resources for our culturally and linguistically diverse New Yorkers. So the definition of health literacy is defined by Healthy People 2030, where personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So an example would be when, for example, I would ask my mom, even though she spoke English, her preferred language, and the language in which she got sick, and the language in which she accessed her emotions were Spanish. And so we would ask, oh, so how was that appointment? What did the doctor tell you? And so that response is where we had an idea of what her understanding was. How do you navigate the healthcare system when many of our communities do not have this kind of Western-based, US-based healthcare system and may have more so a model of socialized medicine? So then we add this cultural and linguistic layer to a healthcare system here in the United States. It's difficult to navigate English to English, and it becomes extremely, extremely challenging. The second part of the definition for health literacy from Healthy People 2030 is organizational health literacy, and that's the degree to which organizations enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So if I have a provider who is explaining something to me, and I think my English is okay, they're explaining something to me and I don't understand, I have to feel empowered, and our communities need to feel empowered to ask the question. As a situation that happened with myself and receiving some lab results, they asked me, what questions do you have? And I said, I don't understand this sufficiently to even formulate a question. And so how do we empower our communities to be able to move forward and become more empowered and know that this is their right for services, whether it be language access or health literacy? So we can infuse health literacy and language access practices into our knowledge base. Also educate healthcare providers on the provision of language access services. Some providers aren't aware that this is required for the provision of services. And again, there's some criteria behind that as well. However, in general, it's there. Encourage providers to utilize health literacy techniques such as Ask Me 3, Teach Back, and the newest vital signs. All of these just take a moment, and I understand that there are time constraints with our providers. However, it's going to add to time when the caretaker or the individual who has certain needs doesn't understand or is feeling intimidated to ask how or what they're supposed to do. Because if they don't do what they've been asked, then what happens? These individuals appear to be non-compliant. Be aware of the importance of readability and numeracy tools such as PMAT, with the Patient Education Materials Assessment Tools, and SMOG to ensure effective, culturally relevant communication in the creation of documents. Because if they are readable, if you will, when they are written in English, and a lot of the readability and numeracy tools focus on English. There are not readability tools that are available in languages other than English. So it's important when these documents are being created that they are prepared in a way to be converted into the target or secondary language. And so having these available, and also for our other communities who have needs in addition to this. So we need to be able to continue to build that trust, because when that trust is high, then the communication becomes much more easy, instant, and effective. I'll pause there. Thank you very much.
Thank you so much, Wilma. And finally, Mustafa Rifat, PhD student and candidate at the Washington University School of Social Work. Go ahead, Mustafa. Floor is yours.
Thank you very much. It's an honor to be here. And this is really an important and very timely topic that we need to center disability rights in immigration issues. So from my experience as a refugee with disabilities and from my research that I do, one thing is clear that the rate of disabilities among forced migration is significantly higher, to reaching as high as 1/3 of refugees having at least one type of disabilities. So we know disability rates is very high among this population. But unfortunately, when we look at the literature of disability and the literature on immigration, we rarely see these two topics intersecting to tell us what is happening at the intersection of disability and migration. And what that leaves is that what that leads to is that we have the population doesn't know what rights that they have, especially among refugees. Refugees come from countries that often don't have any disability rights. So even if I tell them once that you are protected under the ADA, that's not going to register what that even means and how I can file a complaint if someone discriminates against me. And at the same time, from my research, what I see is that there is also lack of knowledge about disability rights among providers. The recent example that I can give you is like the research that I conducted on this issue is that across the board, providers that I interviewed, 26 providers, that they told me that they lack basic knowledge about what ADA means, what Section 504 means, what state level disability policies means. And what that leads to is not seeing refugees and immigrants with disabilities as individuals with rights. And we know disability rights is the rights to resources, is the rights to live with protection, is the rights to live with dignity. And if you have these two sides that lack knowledge about what disability rights means, then the population is at higher risk of discrimination. And we know from research that when you have multiple marginalized identities, that you are easy target to exclusion, discrimination, stigma. And again, to underline that, you have both sides that don't know much about disability rights. And recently, with this current administration, putting, for example, public charge to the forefront, threatening people that if you disclose that you have health condition, that you have disabilities, that you will be banned from getting your citizenship, that you will be banned from entering the United States. So that just puts additional burden on people to just not disclose that they are individuals with disabilities. And This is particularly problematic in one sense that I recently published an article on paths to citizenship among refugees with disabilities and how this lack of knowledge between refugees with disabilities and service providers, especially medical providers, not knowing how to document disabilities and health conditions in a way that an immigration officers will understand is just creating problems. For example, I think it was 2 years ago when I checked, we had about 47,000 immigrants who passed 7 years mark without getting their citizenship. What that means is that these individuals, most of them lost their SSI, and most of them were at risk of losing their SSI because they did not get their citizenship within the 7 year mark that the USCIS sets. And I would assume that this will be even more problematic as the current administration is trying to create as much as barriers for, especially for refugees and immigrants to get their citizenship. So I think um, this is a time where we need to center disability rights, educate both the population and the providers, um, and yeah, and be aware of the stigma that that comes with with being a person with disabilities. With that said, I very much look forward for the questions and thank you for listening.
Thank you, Mustafa. I welcome Mia Ivis Ripley back to the panel. And let's start the roundtable. Let's start the discussion. So, Mustafa, my first question is to you, since you referenced the article that you published in October 2025. It's really a great article about access to citizenship. And you do reference or study some of the barriers that exist to access citizenship, such as language and testing requirements, disability disclosure, accommodations, and exemptions. I'd like you to talk more about this if you can elaborate on those barriers, but also you say that policies can facilitate or hinder access to citizenship. In your study, in your research, this is one of your recommendations that policies address some of these barriers. So with that, can you elaborate on the barriers and the policies that you recommend?
Indeed. So one of the things that I noticed early on is the, misunderstanding of what citizenship waiver entails, and accommodations. So the majority of, refugees with disabilities that I met, they just automatically assume that they will be getting a waiver, that they are not required to get to pass the citizenship exam, which by the way, the current administration made it much, much harder, added multiple questions, added different things to make it difficult for people to pass the citizenship exam. And so often the time, refugees and immigrants just assume that just because they are 60 years old or 70 years old, that they will be waived from taking the exam. These are false. In my study, I came across participants who was more than 85 years old, and he failed multiple times to pass the citizenship. And it was clear that the age doesn't stop you from writing, doesn't stop you from remembering, doesn't stop you from doing other activities. And the USCIS officers look for particular issues such as, can this applicant remember? And what type of memory issues that they have? Does this applicant have attention issues? And other particular and specific issues that they look for. And if that applicant doesn't qualify, then they are automatically rejected from waiving citizenship exam. However, in the population, the misconception is that, oh, I have physical disabilities that I can't walk, then I will be getting the waiver. That is false. Oh, I have, diabetes, then, I will be getting the waiver. And really the article also geared toward educating providers in starting early. This person is a path to get their citizenship, then you must document these health issues early on, because the USCIS officer will be asking the medical provider that, I want to see what was a diagnosis 5 years ago. What was the diagnosis 4 years ago? What did the doctor talk about? Did the doctor really talk about attention issues, memory issues, and other health conditions that will make it difficult for the person to get the waiver? So the waiver is one thing. The other thing is asking for accommodations, and that is over time is mixed between, accommodation doesn't mean waiver. The USCIS officer might give you extra time, but you have to document your disabilities. You have to ask for it early on. You cannot just show up at the office and say, well, I need extra time. It doesn't work like that. And especially for this period that we are going through, that the administration put extra accountabilities on these officers, the USCIS officers, to apply the policies to its fullest. And so I would just assume that there is going to be a lot of immigrants and refugees with disabilities not being able to get their citizenship. And that is tragedy, because losing SSI means, losing your only income, means in many cases losing your Medicaid. And really you are going to be in much difficult situation.
Thank you, Mustafa. Both Lourdes and Wilma alluded to best practices, evidence-based practices. Really, the bilingual coordinator program is really established as a best practice. The case management feature, very much is like the community health worker and the health advisor that help navigate through some of the barriers that Mustafa is talking about, the lack of knowledge, the complexity of the system itself, which is getting a lot more complex right now. I'd like to ask you both, and Wilma, you mentioned the literacy practices, the language access and the equity practices. So I'd like to ask both to comment on, you all alluded to the fact that we are in a very, very unprecedented times. The ground is shifting underneath us. And so what is the state of practice now? Because we hear some horror stories from the field about lack of access, about fear and invisibility. So as you implement these programs, the bilingual coordinator program, try to diffuse and make sure that the literacy and equity practices, the language access practices are embedded into all programs. So what is the state of practice? What are you hearing from the field, especially in terms of this population group of being immigrant and having a disability? What are you hearing from the field?
I can get started. Yeah, there's definitely like the changes in public charge policies are definitely a challenge. And yeah, for the bilingual coordinator program, one thing that they have shared with us is that caregivers of persons with disabilities prefer not to identify as that, as such. They would prefer to use, the term I'm a parent, but I don't want to say my child has a disability. So I think the way in which they're trying to address this concern is by, again, they're a trusted organization, so they are being open to however clients want to identify themselves, and they want to make sure that they feel that they have a safe environment and that they can request as many services as they can. So that is that's something that they're doing, but of course it is, as you said, Dina, unprecedented. I think that we're all learning day by day how to respond to these new circumstances. As Ona, yeah, is also responding to this by we have expanded the hours of operation of our hotline. So before it was only Monday through Friday hours, and now the hotline is open every day, basically, which intends to respond to some of these new demands and the fear that is everywhere. So, and I just want to say before I pass it over to Wilma that the hours of operation on Monday through Friday, 9 a.m. to 8 p.m., and Sunday and Saturday, 9 a.m. to 5 p.m. And we hope that through this, new Americans can call. The calls are anonymous. We offer referrals in over 200 languages. So we hope that this also helps new Americans to access services.
Thank you. Yes.
So it's a little bit slightly different in our area regarding models and where the information's coming from, because what I'm looking at right now from a health literacy perspective is more at the national level to inform what we're doing at the state level. And so some of what we are hearing is that there still needs to be a lot of work to do to inform our communities. There was a lot of confusion with language access and the one guidance that was written to eliminate the other guidance. And it stopped at the guidance level, right? Title VI from the Office of Civil Rights is still in place. American with Disabilities Act is still in place. And so, knock wood, and I'm knocking wood all over, right? And that is where we continue to inform. So any requests that we receive or any information or regarding the questions regarding this, because of the work that we have been doing and has been shared with me and my program, we are able to provide the correct information. We have really supportive language service providers. As I said to someone, if they were willing to hop on a call with me at 8 p.m. during the pandemic, they will hop on a call with me at 2 p.m. during the week. So when we need these supports to inform, to educate, what kind of materials, what communication information can we send out, how can we support outreach efforts from OGS, Office of Language Access. That's what we're able to do, because some of the information that's still coming back to us is that lack of awareness, individuals still paying for interpreters out of their own pocket for services that should be covered. And during these very challenging times, the financial situation for many, whether you have, and you're an organization or an individual, those budgets are fragile. So having that, the ability to be able to respond in a timely manner, to provide services, to support New Yorkers who are trying to get information or ask a question or meet with somebody that is related to a program or initiative that involves the Department of Health, we will make sure that we make every effort to support that from a DOH perspective. Granted, we work in a very regulated environment. We do not have, or I myself, I do not have all the answers. There may be things that I may need to reach out to a colleague. And so this is where those relationships built on trust are really, really important. So what we're looking at is what we want to respond. We don't want to react when we're hearing certain situations, because at the end of the day, there is an individual who is trying to ask a question and utilize their voice because their preferred language is not English or spoken. That should not be a barrier.
And so we are definitely, in a way, we are very lucky to be in New York State, where we're still holding on to equity and inclusion as values that are really embedded in everything we do, as demonstrated by Lourdes and Welma's work. And so, what can New York do? Oh, Mustafa, I see that you have raised your hand. I will just throw out a question here, and please feel free to respond. Do you feel that we have safeguards in New York? Are we in obviously our residents, our immigrant population are facing threats, as you've all we're not protected, no one is safe. However, what can the state do to increase those protections in terms of instituting safeguards? So Mustafa, I'll go to you.
Thank you. So I just wanted to underline the complexity of the language issues, because that is really, really important. With my recent study, I conducted a multi-case study with deaf refugees. Unfortunately, language access in the United States has not reached deaf population. So deaf refugees in the United States, they continue to navigate these systems without any language access. And they get lucky if they get I don't know, like Afghan Sign Language or Arabic Sign Language. And it is crisis. It has consequences. It has severe, severe implications. The other point that I wanted to highlight is the issue of interpreter misconduct. This was a common issue that was discussed across the board in my recent research, in which even like spoken population that they have access to interpretation. So just having an interpreter doesn't mean you are getting equitable interpretation. That is based on the ADA's outline that sets clear guidelines what interpretation should look like for people with disabilities. And unfortunately, what I found is the issue of stigma, the issue of power differences, the issue of being called names, misinterpretation, inability to interpret emotion and tones, which all contribute to poor quality of access, especially in healthcare. Yeah, I just wanted to highlight these 2 points before we move from the language issues. So I oftentimes I notice that we just, don't talk much about these 2 issues.
Yeah, we'll keep going from practice to policy a lot here. So back to policy. But I recognize there is a question there in the Q&A, and I'd like to honor the participant here, Mary Joan Reuter. She says, agree with need for long-term documentation on medical disability waiver, but please comment on June 13th, 2025 USCIS letter about overuse and fraud in N648. Mia, would you like to take that question on?
I don't think I'm the most qualified on that question. If you can send it to another person, that'd be great.
Anybody, it's open for anybody to take it on.
I
Yeah, I'm not the best resource.
I can
Mustafa?
comment on it.
Yeah, sure, go
Um,
ahead.
so indeed, I think I want to take one step back and just like, show how the current administration takes a population's vulnerability and turns it into, oh, there's a fraud, or like this group is taking advantage of the current policy, where in reality, particularly to answer that question, is that refugees and immigrants are confused on how to navigate waiver, on how to ask waiver, when to ask it, because there is no companion that they can rely on through this process who fully understands how to seek waiver, how to seek accommodation when asking for citizenship. So, and you know, before blaming the population, I would question the system. Are we equipping
Mm,
providers with the knowledge to make sure that these vulnerable at-risk population are aware of how to seek waiver? The providers, the medical providers who should have some knowledge about how to document, how to guide, and how to, help these population are equipped with the knowledge. So I'm not buying the fraud allegation here, and I'm turning the question to the government and asking them, are you providing the needed resources for the population to navigate through this process? And the answer is no.
Mhm, mhm. Yeah, I think there are preconceived assumptions of criminality and wrongdoing, before, and never really a question of how is the system helping, people understand and be aware of.
Can
Go ahead,
can I
Mary.
add to it? Yeah,
Sure.
I think this is also not only is it connected to some of the basically victim blaming
mhm,
of immigrants, it's also a reflection on how society sees disability as well. Because
mhm,
so much of these services and exceptions that disabled people are able to get are you have to prove that you have X disability and that disability is severe, right? And so one of the problems we've seen is that not only is there, this administrative burden that you have to prove that you have some type of disability and you're disabled enough that you need this accommodation, but not so disabled that you are not able to you know, get into the program or get the services that you need. This is reflected in general disability policy. You look at things like Medicaid, and there are conversations around Medicaid fraud, which is a majority of that is being done by providers. It's not being done by the individuals who need the program. And
mhm,
I think there was another one about recently, an article about uh, education and the usage of 504 and IDEA. So, I think that it's a combination of, we want to make it so, so difficult to become a US citizen because we don't believe that you deserve to be here. Plus, disabled people generally just don't deserve to be in society.
mhm.
And Wilma Lourdes, you want to comment?
Um, so sure, I feel as if we're going in a few different directions. However, I just want to, I see both sides to the point of what, folks are saying is so what are some of the challenges that our communities are experiencing in relation to the question that was presented, right? And then and the phrasing that Mia used, basically blaming the victim, it just really sticks in my head because a lot of times it may seem that it's our fault. And I don't want to sound Pollyannish about it. However, some of these concepts are very Western based. And not that our communities are trying to, as the perception may be, beat the system. We have to remember that our communities are survivors and they will, without a lot of information and or guidance, it may give the perception that they're trying to do this, beating the system, whatever that may be. Right. So I would prefer to think of it as giving a little bit of grace and then again, encouraging, empowering, and educating our communities. So what's the appropriate, back to Mustafa's point about somebody thinking they're diabetic. So bam, they're automatically going to get, fall under a certain criteria. Well, when that may not be the case. One of the things I do want to circle back on, and thank you for your comment about policy and practice and us going back and forth between the two, is the issue of the sign language here in the United States. And that is so important because this is where I think education needs to happen with many folks, with many, many folks that I remember once when I was hospital based and as a healthcare interpreter for many years, one of the providers came up to me and they said, "Oh, that family, I'm from Chicago. We had a huge Bosnian population come in because of the war." And they came to me and they said, "I can't believe it. This family doesn't understand universal sign language." And I said, "Well, because it doesn't exist. There is no universal sign language. Every country has their own." And so during the pandemic, when I was asked to bring in a Spanish sign language interpreter, I said, "Okay, well, from which country?" Because just like you have, British Sign Language, Australian Sign Language, Irish Sign Language, US, American Sign Language, it's going to be attached to the country the majority of the times. So I had to take this as a teaching opportunity to have folks understand that because you say Spanish, the interpreters don't come out of a box, right? So help me understand how I can best support you, and I need a little bit more information. And then regarding the interpreter misconduct, that is a huge concern and a huge issue. And so one of the things that may be helpful, because by somebody saying that they're bilingual does not automatically make them an interpreter. There's a lot of work behind the scenes that makes it sound as if as one provider said to me, "Oh, your job must be so fun. You get to speak Spanish all day." And I thought, well, a little bit more behind that, right? So, I would strongly recommend that when somebody's utilizing that term interpreter, that they understand that there is either a training or a certification behind that, and that also that they have gone through the National Code of Ethics for Healthcare Interpreters, and that is available, and that's separate from the ADA Code of Ethics. So the National Code of Ethics of Healthcare Interpreters is from the National Council on Interpreting in Healthcare. So that is easily available and accessible and free to the public. It's currently in the process of being reviewed because when we first published it, I don't even want to say how long ago, this was when it was seminal work. And now as the profession evolves, so do human beings and so do circumstances. So I'll pause there. Thank you.
Well, thank you, Wilma. Yes, absolutely. You need medical interpreters, and we really appreciate all the work they've done in this space, Wilma, at the national level, for sure, to bring out this need to really have trained medical interpreters. Lourdes, go ahead.
Yeah, just to build on this conversation a little more regarding language access services and problems with translation and interpretation. I think one of the things that works in terms of like integration and inclusion is, trying to have like local trusted community-based organizations, right? One example I wanted to share with you is at the Bilingual Coordinator Program, the staff from the Chinese American Planning Council, which is the organization that implements the program in Brooklyn, New York, they created a resource guide to share disability services. But the way they created the guide is not just by looking at whatever's available. They actually ranked which providers spoke fluently Chinese languages like Mandarin and Cantonese. And then the Chinese American Planning Council, they share this information with New York State agencies and with other service providers just to raise awareness on what qualified interpretation services look like and kind of like also how to improve language access services for Chinese communities who are the second largest non-English language speaking immigrant community in New York State. So that's something I would consider a best practice. Of course, there's a lot of work that still needs to be done. But yeah, I think one theme that we have all identified today is the importance of like trusting organizations and building that trust with immigrant communities.
Absolutely. Thank you for bringing that out. Trust is really an important piece here. And I asked, what is the state of practice? Because, we are building infrastructure. We've been building infrastructure for many, many decades. But then we'll see that trust being really dismantled or destroyed by the fears and the threats that are out there. So I go back to the question that I posed earlier about what can we do in New York State to increase protection as much as we can. As you spoke, we could identify a number of policy measures that need to be implemented in the workforce front, but also with the communities, really. What would you hope, and the question for all the panelists, that New York State would do as we start the legislative session here in New York State that would fill some of the gaps in services that you talked about, that would add a layer of protection as much as protection is possible in this atmosphere? What would you hope to see with respect, particularly with immigrants with disabilities?
I can go. And I asked this question in one of my study. The answer was across the board is to center the voices of the community, center the lived experiences of the community, and really making sure that at any opportunities we open up the doors for leadership position at an accessible table, an accessible chair on the table that the community can come and voice their needs. Because, just example of deaf refugees, I never, understand how it looks like to navigate these systems. And I need to be closer to people who are experiencing these problems firsthand in order to understand what's happening. The second solution that raised from my study was, building the partnership and collaboration between disability and immigration organization. This is critical. These two organizations live in silos. They do not communicate, they do not collaborate, they do not share resources, especially in this difficult time. And to me, it's a crisis that we need to make sure that in every city, in every state, that this work needs to start. And I can refer to an example that is happening in Buffalo, that they're with the leadership of Pam, the director of Refugees Journeys Ends.
Buffalo.
In Buffalo, and she started a task force on refugees with disabilities to build this partnership between disability and immigration organizations. And I have been following how this work is growing, and I think it's so important. With that, yeah.
Yeah. Anybody wants to comment on that? What can New York State do? And you, Lourdes and Wilma, you are in really very, very special positions here. What would be your dream that New York State takes on, whether in funding programs or enacting policies for protections, further protections or enhanced protections for this population?
You know
Yeah,
that
go ahead,
go
Bill.
ahead, Lourdes.
No, you go
No, go
first.
ahead. Yeah, all right. That is such a, in social work, the miracle question, right? So if I could wave my wand, what would I do? Um, I really appreciate the legislation that is currently in place, because it's come a long way from not even having the EO 26, right, that we had for language access. I, for myself, I, I, I feel that some of it is already in place, so that's a real positive. The challenge, I feel, because we have so many talented people. For example, with DOH, our leadership is completely supportive, and that's part of it, right? Um, and that's a big part of it when your leadership is supportive. And that's why for the class standards, when we revise them, that first principal standard states that it's a leadership buy-in,
Yeah,
right? Otherwise, this is
absolutely.
just a nice conversation and it's not benefiting our communities in any
True.
way,
True.
right? So I think that, and again, kudos to the Office of Language Access, those who, on whose shoulders current leadership currently stands, and those who will follow, that there is trust, I feel, which is really important, and there's communication. So if for myself, if I have a question, I feel very comfortable and confident and safe in reaching out to ask those questions. And I, it is my hope that despite these challenging times, that those relationships continue, because trust is one thing, being trustworthy is another.
Mhm.
And the time to build relationships is not when you need that person, right? Because I can say, like we say in Spanish, oh, ahora sí me encuentras, right? Oh, now you know how to find me, right? So it's my hope that continues. And if there's any way that, I myself can support that, I'm easy to find.
Thank you, Wilma. Lourdes?
Yeah, well, that was a great reflection, Wilma. I took notes. Yeah, I think partnerships in general are what personally gives me hope. Partnerships among New York State agencies have proven to be really um, helpful and powerful in just, yeah, supporting new Americans and new Americans with disabilities. Also, yeah, task force, Mustafa, what you shared about Pam Kefi and the work she's doing, which is great. Finally, the intersection of immigration and disabilities, which is much needed, and communities of practice, and all of those spaces where I think we can collectively brainstorm and think about solutions are very much needed. And additionally, I was thinking part of the work that um, Ona has been doing over the past year or so is just um, having Know Your Rights trainings and creating Know Your Rights resources uh, focused on immigrant rights, but it is also our hope to develop these resources for the immigrant with disability community as well. Um, so yeah, that would be part of my hope for the
Mhm.
for the
Thank
future.
you, Lourdes. Mia.
Yeah, I think when I'm thinking of how do we support folks in the most equitable and efficient way possible, utilizing what we have in certain states. And I I'm trying to say this in a any type of state that you might be in, is that looking at networking or even mapping what resources are already in the community, what organizations are already in the community, who is providing mutual aid and support, who is providing language access services, who is providing specific assistance to people around relocating, et cetera. Mapping that out and figuring out which programs are in need of funding, in need of support. Because so often what the government tends to do is it writes a law and then tries to build something on top of a system that was already in place. And then that ensures that the organizations and the networks and the community often loses a lot of its autonomy and its ability to support its own self. And so, I think it's really, really important that we really emphasize the importance of naturally occurring community supports and funneling that money into those programs. A lot of times I'm thinking of sort of like in Minnesota, they've built up a ton of mutual aid programs, training programs, resources and supports, translation and immigration services, legal services, etc. Tap into that. Tap into places that are already doing the things that you want to support. And that's going to be much more efficient and likely more financially feasible than building up, another department, another agency, or something like that.
Absolutely, Mia, you bring up a very important point that happened after January 2025, where funding has been scrapped for many refugee and immigrant serving organizations at the federal level. And so many of these nonprofits have closed their doors. And New York State has been left scrambling, trying to maintain that infrastructure that took many decades to build, that we saw being dismantled in matters of months, really. And so what you're saying is really protect that system, try to fortify the system that already exists. From where you're sitting there, are there survival strategies that you are seeing the nonprofit sector used in reaction or in response to those threats of pulling back funding, and are there partnerships among these nonprofits, mergers that happened, or similar models to maintain operation and to avoid being having service disruption that you've seen in your world, specifically with immigrants and maybe immigrants who are experiencing disabilities?
Yeah, unfortunately, a lot of philanthropies are pulling back on immigration stuff. Partially it's because they just haven't seen any wins in the last, since DACA got implemented. And so we're seeing a lot of philanthropy groups pulling back on a wide range of immigration things. So it is a very scary time to be in a nonprofit organization.
At a time when we really needed these philanthropic dollars more than ever.
Yes.
So
yes,
it doesn't,
exactly.
It's so counterintuitive in a way.
Right. And then the other problem is that the administration is going after some of these philanthropy groups as well. And so there are some groups that are very skittish, either skittish to provide funding to a nonprofit, or the nonprofit is skittish to provide services to migrants and immigrants, et cetera, because for fear of being targeted by the administration. And so, that has caused a couple of things. One, a reduction of funding. Two, a sort of forcing a lot of nonprofit organizations to go into hiding, basically. And so you have this sort of secret network, but what that does is it just makes it more difficult for those individuals to get the services that they need. So it's going to be even more essential for state government and local government to think about, one, how do we siphon money towards these programs to help support the infrastructure? Because it's much easier to keep a system going than it is to wipe it out,
Rebuild
which
it.
we are,
Yes.
yeah. So what we're seeing is the administration is has a very easy time wiping everything out. But us trying to rebuild that system is going to be significantly difficult. And so, I think that we also have to think of how do we get out of the bounds of traditional grant structures as well? Because so often when we do grants, it's for a specific thing and you're required to show specific metrics, et cetera. And it doesn't take into account the actual things that are going on the ground. And so what that results in is, organizations swooping in that don't have any experience in that community, but they know how to get grants. And so, they might not be the best organization to be providing these services, but they do know how to get grants. So I think there's a couple of things that the government state governments can do to help reduce some of that administrative burden and ensure that the money is going to the right organizations and the right services.
Excellent points. Thank you, Mia. So I'd like to give each of you a chance to give closing remarks on advising all of us, what from your vantage point, what can we do as a community of practitioners, providers, scholars to better protect communities of immigrants with disabilities and really try to bring that focus of integrated lens into the context of their lives research policy or practices that you would recommend at the final thoughts. Anybody can jump in.
For myself, I will continue to educate myself on the facts. And, we had some trusted partners at the federal level who now may not be as reliable as in the past. However, maintaining information from trusted colleagues, individuals who are at the forefront of the work that we're doing, because there are fiscal components that have to be addressed. And these are very challenging times from that perspective. However, information is power. And if we remain informed, then we can best support those whom we serve and with whom we partner and identify those with whom we can continue to support the work that will lead to healthy outcomes for our immigrant and communities who are requiring and have the right to services.
Thank you. 30 seconds, Lourdes. Sorry to bring it down to 30 seconds. Closing remarks.
Yeah, no, thank you so much for the opportunity to be part of this panel. I think for us, for ONA, continuing to identify and elevate the barriers that new Americans face with partner institutions, with community-based organizations, that would be a priority. And again, continue creating multilingual resources, trainings, those are impactful.
Awesome. Thank you, Lourdes, Mustafa, and then Mia.
I would say we really need to meet people where they are and make sure we meet their needs as we continue. And the second thing is like, I think we need to debrief that yes, we are living in a challenging time, but in the past, we have experienced so many times these similar issues. So if we
Mhm.
take a step back and look at the history of the United States, we always go up and down. So yes, this is a difficult time. I think we need to keep going. The sun will rise soon.
I love that positive note. I love it. Mia.
Yeah, I'm somewhat off of what Mustafa says is that really lean on those communities. Don't make assumptions that you know exactly what those communities need.
Mhm.
Those communities are going to be the experts of the needs in that community over anybody who is doing, book research. So really
Mhm.
utilize those individuals, really utilize those networks, and, be willing to listen.
Absolutely, Mia. Cannot agree more. And goes back to Mustafa's representation at the decision-making table, which we all need to really take into account. With that, I want to thank our distinguished panelists, uh, Lourdes Aguas, Wilma Alvarado Little, Mia Ives Rubli, and Mustafa Rifat. You guys have provided us with an enriching conversation. The conversation is by no means ending here, but starting. Yes, we get a lot of hope and positive energy from the work that you all do, the commitment that you all have, and really fortunate to be in New York State. Before we end, I'd like to acknowledge my colleague, Guillermo Martinez, who is here on the screen. Guillermo is the Deputy Director of the Institute on Immigrant Integration and Intergovernmental Liaison, and an incredible, powerful force behind everything that the Institute does. He may not be moderating this panel, but he is the force behind organizing these webinars and always thoughtful, always incredibly well organized, and thank you for carrying the torch of the Institute. I also want to thank Wilma Alvarado Lero for being a co-chair of our board of directors at the Institute. Thank you all for joining us today. And with that, please remember that we have a series of webinars that are happening every month. You see them here on the screen. Mark your calendars, register, and join us. Also, a recording of the webinars will be posted or uploaded on YouTube for people who couldn't be here live. Let's continue the conversation, and so long, everybody. See you later. Thanks again.